what role can exercise movement training play in treating nociplastic plane?
Perfect. Yeah. So that is actually another, again, as movement professionals, we're all kind of biased here, right? So what can we do from our perspective? Um, and this is, again, a big part of my project, utilizing FMS principles, is movement is absolutely something that you want to encourage in these folks. Sometimes, unfortunately, we have kind of this quote unquote pendulum swing in researching things. I know pain has gleaned a lot of attention in past years, and having a discussion about what pain is, and kind of like what we're talking about now, some of the physiology and how do we help people to relate with what they're feeling. Maybe so much so that we've forgotten that people need to actually move, and how do we best treat the movement issues that are going on. So what I looked at was utilizing SFMA, selective functional movement assessment. Again, that's that diagnostic principle of looking at how somebody is moving, and letting that be maybe more of my guide, particularly in these individuals. So an example of this would be, somebody who's maybe has mostly painful patterns, or you're having an interview with them, and this sounds like, man, do I even really want to make this person move in all of these top tier patterns, because it's probably just going to set them off. I would encourage you to go ahead and try, because in looking at all of those different patterns of movement, again, those are top tier patterns of movement that this person is probably going to be doing on a daily basis anyway. And so you're just looking at movements that are functional and foundational, but you're also going to be hearing kind of what the response is to those movement patterns, and that might surprise you. So you may have somebody who complains of diffuse pain all over the place, and lower extremities and back and upper extremities, but yet when they do standing multi-segmental rotation, where your arms are down at your side, feet are together, and twist, they might feel like, well, that's not so bad. I feel pretty good, just maybe a little tight. Well, what that does is that lends you an opportunity to maybe go down some of those patterns of movement that involve multi-segmental rotation without getting into all the weeds. The FMS principles explain a lot of that, as far as treatment patterns and different things to look at. But that gives you some ammunition as far as different types of movements to practice with that individual. Maybe that's just working on rolling patterns when they're on the floor, or like a side rotational crunch sort of pattern, or things of that sort, so that you can actually work on movement with that individual, or get them moving. But along the way, there may be highs and lows to that, or days may be different where they can tolerate more movement or not tolerate more movement. Because again, there's a lot of other external factors that are feeding into that person, right? And just some sort of movement in general, maybe from an endurance quality perspective, because we also know from research that there is an endorphin effect from moving, getting a little bit of heart rate elevation, getting improved circulation throughout the muscular system. It helps with lymphatics. There's a lot of different multifactorial things that movement helps with. And why do we suggest diet and exercise for most any kind of a diagnosis for anything, right? Is movement is one of them. We need to be able to move, and there's a lot of important things to our quality of life, our mentation, but also our musculoskeletal system for trying to get people to move. But with this diagnosis in particular, it may be a journey and an exploration. So having taking this, and this is where I see FMS principles as being very helpful here. It gives us something of a guidance as to what may be of best benefit for this individual, particularly that is sitting in front of you, and where movement pathways could take place, versus something where you have no guiding ship necessarily, and you're just going to kind of throw darts into the dark, and hopefully you hit a movement that works well for this person and doesn't maybe flare them up or set them off.